Now on 7, 2 Steward hospitals will close in a matter of hours. Kearney Hospital in Dorchester and Neshoba Valley Medical Center in Air are no longer treating non-emergency patients. Both facilities will be officially closing their doors tomorrow morning. 7's Jonathan Hall, live for us in Dorchester, where people are voicing their frustration. Jonathan.
Well, I was just in the ER a couple of minutes ago, and it is empty. It is basically a graveyard in there. No one is there. These two hospitals closing tomorrow morning at 7 a.m. It's been a very sad scene here. Ambulances will be on hand at the hospitals for 7 days in case someone shows up and needs help.
Kearney Hospital, where lives began and where they ended, where surgeries were performed and diseases treated, is about to see its last patient.
I'm just here today to say my goodbyes.
A city employee put up a sign this morning a bit prematurely announcing that Kearney is closed. That will actually happen at 7 a.m. tomorrow. It has been a fixture in Dorchester since 1953. We found employees breaking down in tears on this, their last day. You're sad, but you're also angry.
Right.
More than angry.
Yeah.
I don't even know how to even explain it. More than angry.
Narkia Washington and her co-workers posed for photos and discussed their bankrupt employer, Steward Healthcare.
They came into this because they wanted to make profit. This was all about real estate. It had nothing to do with health care.
Right.
And we're paying the consequences for it. The effect of it trickled down to the employees. We have nowhere to go.
Ambulances now come up Dot Ave without stopping. Boston EMS stopped bringing patients to the ER as of 7 a.m. One young woman came by to retrieve a promotional poster of her grandmother, now retired. She was a cafeteria worker at Kearney for many years.
We're really going to miss this place, and it's a huge loss for everyone.
Protests like this one at the State House Wednesday failed to save Kearney. What's next for this 70-year-old hospital? The property's future is in the hands of a federal bankruptcy judge in Texas. The highest bidder could be a real estate developer interested in building a giant mixed-use project and not a medical facility as the city wants.
What you would have to build here just to break even on the cost of demolishing this place and the environmental cleanup, you'd have to drop the seaport right here in Lower Mills. Zoning doesn't allow for that. I don't allow for that. The mayor won't allow for that. There's a lot of things working against you if that's what your thoughts are.
It remains to be seen what will happen. One nurse who's worked here for 40 years took a photo of the hospital she loves. She told me she's too broken up to speak on camera. The loss of this hospital tomorrow and the Neshoba Valley Medical Center in Air has people feeling like they're attending a funeral.
I feel like myself and many other people are in mourning.
The state says it has a plan to help workers find new jobs, to file for unemployment, and has a plan to help people find quality health care if this hospital is closed, which is happening in the morning at 7 a.m. We're live in Dorchester. Jonathan Hall, 7 News.
Turning out of the race for the White House.